And on behalf of Tanya, Denise, and I, we'd like to welcome you warmly to this afternoon's webinar on lactation loss and NEC awareness. We'll hear about professional and personal experience of this really important topic from our excellent lineup of speakers. So we have Tanya, as she says, is going to speak, Dr. Cora Doherty, Emma Savage, and Joanne Deering. We'll end with a discussion and a questions and answers session. So if you want to pop your questions into the Q&A box or the chat box, we'll get to them in the end, at the end of the webinar. So Tanya's going to start off the afternoon with a talk on cultural considerations of lactation and loss and a review of international research. Tanya is a cultural social psychologist who for many years has been researching in the area of lactation and donation of human milk. She's been awarded numerous prestigious grants in the area, including a EU Horizon grant and a Fulbright Award. She's a member of the group that developed the British Association of Perinatal Medicine framework for practice on lactation and loss. So over to you, Tanya.
In terms of, I always start with a bit of a background about myself, because as a cultural social psychologist, or which is a long term that means I've studied anthropology, sociology, and psychology throughout my career and try to actually integrate a number of those things. It often means that I don't fit comfortably into any one social science field, but which is part of the reason why I currently work in the School of Nursing, where interdisciplinary work is very much appreciated. But I have been very fortunate to have a number of the projects that I've done be funded, as Gillian pointed out, and these I often recognize are important for the topics themselves. Breastfeeding and human milk donation as well are often topics that are not as discussed, particularly in places like Ireland. As you can hear my accent, I wasn't born on this island, although my last name is Cassidy. So my husband likes to point out that I can wear my hyphen in both directions. I'm originally from Canada, so I am an Irish Canadian, but I also have spent more time living on this island now. And so I consider myself Canadian Irish as well. And therefore, I tend to always think locally, but also globally. And those are components in terms of thinking about this from my disciplinary background as well. But I also, as a researcher, often recognize that it's very important for us to have our research be presented to as wide an audience as possible. And this has been part of the reason why we developed today's webinar, but also it's connected to some of the other work that we've been doing on this. I've actually been working in this area since 2005, and I have spent a lot of time writing a number of things for a number of different journals and places, and over time, increasingly, there has been a recognition about a number of these issues. Specifically about bereavement and lactation, the journal Maternal and Child Nutrition, which I became involved with during my EU project in the UK at the University of Central Lancashire. That journal, when I suggested that we run a special issue on bereavement and lactation, immediately took up that offer and thought it was very important. That actual due date, what is today, for that journal, which we are planning to have ready by October to celebrate Pregnancy and Infant Loss Awareness Month, which Gillian and Denise and I will be holding another webinar in October about breastfeeding, which is also Irish Breastfeeding Month. And so we, in terms of that, we're trying to think of that, but we have actually extended the deadline by a couple of weeks so that to reflect today's input. So if anyone who's listening today finds that they have some research on this topic that they would like to contribute to this special issue, please let me know, and you can email me directly. I also wanted to point out that a lot of this research that I do as a social scientist is looking at relations. So we look at all of the different stakeholders' perspectives, not only donors, but recipients and staff as well, and staff from a variety of areas, and researchers themselves. This image is actually from a colleague who has written a wonderful book called Carry You With Me, which is a storybook that I had originally given to me by people working in the milk bank in Calgary, who then introduced me to this person. And we then ended up working together, and she gave us permission to actually use the images here. This is a topic that clearly has connections all over the world. And as an ethnographer, I have this image here. This is actually from UCL. I like to show it because it shows the playful nature, the child nature of how an ethnographer thinks. We're trying to put puzzles together and how we think about things. For my own work, I actually use the Rubik's Cube, which a colleague once said to me, "Are you trying to solve the cube?" And I said, "It's not about solving, it's about the journey and all of the different permutations." So we actually even capture the symbolic meanings of the colors themselves and how important they are. This is all connected to thinking about complexity and how complicated not only breastfeeding, but in particular, bereavement and lactation can be. Lactation is an issue in parts of the world, in particular Ireland and the UK, is something that people don't talk about. But then when you add in thinking about death and bereavement, we then have another level of potential silence that's part of this narrative that's very important. And so recognizing the complexity within that, and then offering overarching paradigmatic arguments about how to think about it is part of what we try to do in this narrative. So I've also put here an image from colleagues of mine. The one on the left is from Poland, describing the process of the milk bank from donor to recipient, and the other one was from the Calgary Milk Bank that I had mentioned before, that was connected to thinking about the Carry With Me project. But I just wanted to show those as images to recognize the different components involved in this lactation and donation. But as an anthropologist, we actually have lots of different ways of looking at things, and I would fit within what is called cultural or social anthropology. And within that, we have medical or psychological anthropology. So we think about issues in terms of health, but also individual components. And then within that, all of the areas that I work in are extremely emotional. Maternity has hormonal components, which many of the other speakers might speak about, but we also have underlying all of these characteristics of thinking about emotions, issues that I've talked about both cross-culturally, but also historically, where even the terms of emotions change, whether we talk about feelings or emotions. And in the 18th century, we talked about passions. This is all set within a feminist anthropological frame. I've mentioned a few of my favorite feminist anthropologists here, from Ruth Benedict and Margaret Mead, but also Nancy Shepherd Hughes and Michelle Rosado, who published with Louise Lamphere a very important feminist anthropology text. The reason why I mentioned her is because she passed away in 1981, and her partner, Rosaldo, had actually published a very important article about grief and thinking about grief from an anthropological perspective. He had done work in the Philippines and had talked to individuals who had headhunted, and they had told him about how and why they headhunted. And he said that when Michelle died, he could finally understand what the headhunter was telling him. So this link between rage and emotion and grief were key components for him to understand. Nancy Shepherd Hughes, famously in Brazil, wrote about when she was there, she saw mothers who did not cry when their infants died. This, she then argued, was linked to cultural representations of thinking of distancing oneself from your child. But we also had others who have argued that Nancy's perspective should be better thought of as public versus private expressions of grief. And that Marilyn Nations has argued that within Brazil at that time, when she also did work, that there were private expressions of grief and crying. This image she has from Brazil from the 1960s of the mother crying at the grave of her infant. We also, the reason I mentioned Brazil and bring this up is because Brazil is the leader in terms of the world donor human milk services, and therefore a key and important aspect of talking about human milk banking cross-culturally. There are almost as many milk banks in Brazil as all of Europe as a whole. This is an image of how that changed. They also have linked it to breastfeeding, which is an important component because with the WHO, their link to thinking about breastfeeding became an important characteristic, and it has led to the expansion of milk banks, particularly in this century, but on the island of Ireland as well, arguing that milk banks need women to breastfeed, but it's also a symbiotic relationship between the two. This is an image of milk banks around the world. It's an older image. Each dot represents many milk banks, but a more recent global map has been put together by a global health group called PATH that's located in Seattle. Each of these dots actually are interactive, and you can they give you the name of individuals and the address for each of the milk banks. They now have, I believe, almost 700 milk banks across the world that are part of that. I mentioned PATH because they, a couple of years ago, put together and made available free to the world a set of tools, toolkits about thinking about donor human milk services. One of those was a counseling guide for engaging bereaved mothers. That it's the last guide. It's in purple, which has a symbolic meaning in terms of thinking about death in many cultures. And it was something that I was involved with. They had actually based this on research and components that have been done by a variety of people. This is actually a toolkit which existed in the US from 2012 that was linked to the Human Milk Bank Association of North America and was linked to Jessica Welburn's PhD, which at that point was one of the only PhDs on this topic. We now have more. We have, I mentioned Rita Vick's from Brazil's PhD that came out in 2014, and more recent work that's been done by Aliette Orag, who is co-editing that special issue with me as well. This is just an image of the milk banks in Europe, just to let you know, for those of you who are interested. It bothers me because the old image actually breaks down the UK and Ireland. This previous image actually makes it look like we don't have a milk bank in Ireland, but we do have a cross-border milk bank that actually was part of the Good Friday Agreement and serves the island as a whole. We also have a long history of thinking about this human milk donation. This is one of the earliest representations in media in the UK and Ireland of milk banking, and it was in the Irish Sunday Independent in 1937. As you can see, the milk bank is on the border on purpose. It was always there to actually contribute to the island as a whole. And I won't play this video, but if anyone wants to see this video, it's an earlier video that they used to have about everything you want to know about the milk bank. And the manager that is talking about it was the co-founder and longtime manager, Anne McCrae. We actually, I've included this, it's a discussion that happened in 2016 when we were doing our EU project that Gillian Weaver contributed to, for the first time, a discussion of pregnancy loss and death of the baby in the SANS guideline for professionals. But we've moved beyond that. And I also wanted to mention Denise, my colleague, Denise McGuinness's work that was very important in terms of thinking about this issue on the island of Ireland, and especially for healthcare providers. Our research showed that in 2016, these figures, we saw very high rates of uptake on the island of Ireland for mothers who chose to donate after bereavement, some 27, compared to, at that time, the other three main large services had much lower rates. This has changed in a very short period in the 6 years since then. And this is part of what we're going to hear about during the webinar today. We will hear about some of the changes, and I think they're very important and capturing features of thinking about the way things are and how and what influence changes. I have put some pamphlets here as well, just for us to think about, parents' pamphlets that people have in terms of thinking about some of these things. How and when to talk to parents become an important component, but it's also about offering choice and thoughts for people. So that's where I have the New York one, which I like as well. And I wanted to end with thinking about some of these things in terms of milk memories. Donation is not the only option for people. There are many other things that people may wish to do if they wish to donate, or if they wish to have some memory connected to their lactation. Others may not as well. And I wanted to just leave it at that. Thank you.